So for our final project, we are going to cover public trust in COVID-19 vaccines. So the problem, as an outline, overall public trust in vaccines is currently very low, especially with new viruses, most notably COVID-19, are rolling out. They're causing and calling for high rates of people to get vaccinated. Despite vaccination proving to be the most effective measure, there's still a large amount of people that are hesitant to receive the vaccine. And if people aren't willing to get the vaccine, then hospitalization rates and mortality rates will continue to rise. And currently, economic resources will also be drained if the economy is continued to be stifled by lockdowns and social distancing measures. And there are several reasons for this vaccine hesitation, like misinformation about the vaccine's efficacy and side effects, the politicization overall of medicine and vaccines, a lack of trust in the FDA and big pharma, as well as social pressures, biases against the vaccine, and lack of information transparency about the vaccine.
All right, and there's several statistics that back up these statements, all within the amount of people who are vaccinated versus unvaccinated. First off, the numbers of people who are vaccinated and unvaccinated, specifically just looking at the United States, 72% of people in the US have received at least one dose of the vaccine, which is still fairly effective in terms of fighting COVID. And only 60% of the total population right now is double vaccinated. However, as we're seeing with the Omicron variant, more and more people are requiring boosters, but that's another topic. And then of the total US population, 320 million people in the US, 98 million of them are still unvaccinated. And this is specifically a problem when it comes to mortality rates, where 98 to 99% of the people who have died from COVID-19 are unvaccinated, and which remains at 0.8 to 1% of the people who have died from COVID-19 are unvaccinated. And this is some of the issues with the unvaccinated population. So 12% of US Americans report that under no circumstances would they receive a vaccine. This is similar to the outline of the problem where we describe travel groups where people essentially gather and they're putting pressure on themselves, under no circumstances will they change their beliefs about the COVID vaccine. And there's also reasons, or this is the percentage breakdown of reasons for why people are unvaccinated. The biggest one of 56% of people in the study reported that they are worried about the potential side effects of the COVID vaccine, either the short-term side effects or the quite unknown side effects that could occur in the long term. 15% of the people said that they don't trust the government. This also included big pharma companies or healthcare companies. And 10% said that they don't believe COVID poses an immediate threat to them. So they don't believe in getting the vaccine just over, they don't have any reason to.
So our solution to this problem, as an outline, our solution is to have a federal mandate, which would mandate that physicians are on standby for consultations at clinics and stores where the vaccines are available. And as a side note, to make our solution more feasible, we're going to limit these mandated physicians to be in the 10 lowest vaccinated states. This will keep the cost down and keep the burden off of taxpayers while still raising the overall vaccine rates of the US. The physicians would provide free consultations to help patients decide whether the vaccine is safe and necessary for them. These standby physicians will be there to answer any questions that people who are kind of on the fence or want the vaccine have about its safety, the benefits and risks for them and their own health. And this will help to build trust in the medical community and in the physician's recommendations. More trust in the vaccine safety and efficacy overall through these free consultations will help to persuade more people in these low vaccination states to get the vaccine. And overall, a higher number of vaccinated individuals will result in less deaths, less strain on hospitals and medical resources, and help to open the economy and restore confidence within the US market.
The main reason why we're proposing this solution specifically is that there's a greater trust in physicians and medical doctors, as well as nurses, compared to the healthcare system as a whole. So people are much more likely to listen to the personal care physicians or someone who's more trained to deal with their medical records than, for instance, just Dr. Fauci on the news or the CDC or FDA or some of these bigger organizations that are able to give them direct care on their personal medical records and their personal medical history. At the current moment, there's no free consultation service that provides something like this specific towards the COVID-19 vaccine. So if you did want to have your questions answered or something like that, you would have to more than likely go to your actual physician, pay out of pocket costs, which can range anywhere between $80 to $200. So there is a cost barrier that many people don't want to afford to get more information about the vaccine. We believe that this will incentivize more people, again, because the care is personalized to themselves. And as we'll see in the next slide, there's a big difference between direct care and indirect care in terms of the medical community, where people are much more likely to trust the advice from their personalized doctors or nurses compared to the bigger organizations. So as we can see on the left, doctors and nurses, the two orange bars, are a part of direct care, which again, they have access to their medical records. They're able to say, if you do take the COVID-19 vaccine and you have diabetes, you are at risk for this. You are likely helping yourself at this. If you take the COVID-19 vaccine and you have an autoimmune disorder, you're at risk for this and that. Compared to indirect care, this constitutes a whole range of agencies specific to government agencies, pharmaceutical companies, and health insurance companies. But as you can see on the left, there's a huge difference between how much people will trust doctors and nurses compared to government agencies or pharmaceutical companies, close to a 30 to 50 percentage point difference between the two. And on the left here, you see this just breaks it down by physicians compared to the public, where physicians have more knowledge about the healthcare sector, so they might trust healthcare companies more than just the general public. But again, we're targeting the general public in this instance in terms of increasing their trust in the vaccines. So therefore, they're more likely to listen to their hospitals, again, the direct care, their personal doctors and nurses, compared to the government agencies, pharmaceutical companies, or healthcare insurance companies. Okay, now looking at more of the economics of the problem as well as the solution. First, unvaccinated persons impose negative externalities on the U.S. as a whole, both on other unvaccinated people as well as vaccinated people. For one, that they drain scarce resources that diminish the economic viability of a country, and this specifically can refer to medical equipment, hospital beds. They overrun hospitals, people who are unvaccinated, since they're experiencing more severe consequences of the COVID-19 virus. In addition to that, they also slow down economic growth for a country, because if there's a higher population of unvaccinated persons, more social distancing measures and lockdowns would have to be put in place to prevent more higher mortality rates and other consequences from COVID. And we can see this in the numbers as the initial shock of COVID-19 cost the U.S. healthcare system between $10 to $17 billion. Right when it first initially happened, when hospitals were being overcrowded. And this is in part due to the cost per person in COVID ICU, which was between $50,000 to $70,000 a week. And again, this was to do with medical equipment, the nurses, everyone that was tending to these patients. And then also on terms of the macro level, the initial COVID-19 shock put over 22 million people out of work, which obviously increased the unemployment rate between not only people who just lost their jobs outright, but were also furloughed and had a loss of income due to that. And because of this lack of or loss of productivity in the U.S. economy, U.S. GDP shrank by 3.4% in 2020. And because so many people also lost their jobs, Congress had to pass over $6 trillion in pandemic relief, which in turn increased inflation. And now many economic experts are believing that a recession is going to occur within the next year.
So on the solution side, our overall, to kind of review, our proposed solution to this problem is having these standby physicians at the vaccination centers to give free and personalized advice in the hopes of incentivizing more people in these low vaccinated states, the lower 10, to get vaccinated. When more people become vaccinated, their risk is lower for contracting the severe side effects from COVID and, especially other variants, Delta and Omicron, with new ones coming out. This helps, the higher vaccination rates will help prevent the need for economic lockdowns since the spread of the virus will be lessened. Lockdowns of non-essential businesses and social distancing measures. The GDP growth will slowly recover to pre-pandemic levels. If all this keeps going, the unemployment rate would decrease, and stimulus spending will become unnecessary as people are back in the workforce and the economy gets back to normal levels. And then a prediction here is that they state that a year of recovery would produce 1 million new jobs, and that real GDP growth rate would rise by 1/3 of a percentage point, kind of getting us back to those pre-pandemic levels.
In terms of funding for this project, we have two main areas that we want to focus on, and that's the hiring of physicians as well as a marketing campaign to bring awareness to this new program. First, we want to place a physician at as many places as we can, still keeping the costs low. Therefore, again, we just want to focus on the 10 states with the lowest vaccination rates. And we roughly estimated around 100 sites per state, and this is through the federal retail pharmacy program, stores like CVS and Walgreens, and how many stores they roughly have per state. So we believe, 10 lowest vaccinated states times the 100 sites, that's around 1,000 sites in total that we want to try to target. We believe putting a physician at every other location would still bring a good range to people that have get access to it. Then this would equate to roughly 500 physicians needed at an hourly rate of $60, working 8 hours a day for 30 days. That's roughly 7.2 million for 1 month of the solution. And then a marketing campaign, roughly $50,000 per state times 10 states, which would be around $500,000. So all in all, $7.7 million for this entire project. And comparing it to the cost of a person in ICU bed, which is per week $60,000, 7.7 divided by 60,000. All we need is 128 people to get vaccinated in order for this program to be cost effective, which I believe is a great idea for the federal government in terms of saving them money, and again lower the chances of a spike in severe COVID-19 cases. So we definitely recommend that they grant federal funding for this project.
So since our solution is an important measure in this pandemic, it is also appropriate to talk about the limitations of our solution. So first off, since we, like we've already talked about, we're limiting our solution and our mandate to the 10 states with the lowest vaccination rates. So our solution's actual efforts and impact will not have any effect on the remaining 40 states. And again, our impact is also limited to the people who are already on the fence about getting the vaccine, since it's already very unlikely that a physician can influence someone who is already predetermined that, COVID doesn't exist or the vaccine doesn't help. They don't want the vaccine. So our sphere of influence there is limited to people who are already thinking or on the fence about getting the vaccine. And there's no concrete evidence that a physician can actually persuade someone to get a vaccine or influence them fully. But since individuals trust physicians way more than the medical community, like we talked about on the previous slides, we believe that this can be an effective method just because the trust with physicians is already there and it has remained through this pandemic. And due to high physician labor costs, we are limiting our mandate to 1 out of every 2 clinics on average, which means that our solution may not aid in helping those who are very far from the clinics with the mandated physicians, since not every clinic in these states does have a mandated physician. And lastly, there are concerns with disadvantaged individuals in our solution who would not even be able to reach a clinic with a mandated physician for their consultation. Even though it's free, there are still barriers, with transport if they're very far out in the rural areas. But overall, even with these limitations in mind, we think that our solution can be effective based on that trust that has already been built with physicians and has stayed through the pandemic. And we think that this can influence these lower 10 states with lower vaccination rates to actually have more people get vaccinated.